Also in Argentina, the workers at Garrahan Hospital continue their struggle against the policies of President Javier Milei's vetoes of laws that aim to defund education and public health. Our colleague Fabián Restivo with the details.
The physicians at Garrahan Hospital continue their struggle. Once again, President Javier Milei has vetoed their budget, and they must continue the fight. But the professionals, together with patients and family members, have decided on another form of resistance, a party.
We are celebrating that the hospital is still standing and that all the people who organized this festival are workers who are dedicated to healthcare, and today we want to celebrate ourselves.
The space was designed for children to share and continue explaining and entertaining.
Because I support Garrahan with all my heart. It touches me very closely. My niece was hospitalized there and they saved her life. I went several times to perform at Garrahan at the kindergarten. I believe we have to support them with what we have with our tools. In my case, as a clone. Those who can do something else, and so together we put our hearts into this, because what is happening is truly terrible.
The question that needs to be asked is basic and urgent, what they expect from Wednesday's march.
We expect a massive mobilization. We believe that there will be a huge response from society because they support the demand we are making and this time. We are also joining forces with the public university, which is another sector affected by the president policies, so we believe it will be a historic day, where it will be demonstrated that the vetoed party is the government, not Garrahan, not the university, and not public health.
Among those present, there are some who have other reasons of their own.
I am here primarily because Garrahan was everything to me. My son was ill and hospitalized in 1994. We transferred him from a private clinic to Garrahan. He was born in the capital, but due to medical malpractice, he ended up at Garrahan, thank God. At Garrahan, they did everything possible and impossible to save him. He was in intensive care for 7 months. He had a strong will to live. They didn't move him from the neonatal unit to pediatrics, and for the doctors it was encouraging to have someone who wanted to live beyond his diagnosis, which was terrible. I think that's something strong enough to always be present for everyone.
So, what are the Garrahan professionals asking for? What do the Garrahan professionals want?
We want to continue celebrating public health, continue celebrating our profession. We enjoy being involved in our work, being in the hospital, with the children we work with. I don't know if it's something we enjoy, being out on the streets fighting, but it makes us very proud. I mean, one thing doesn't contradict the other.
Desde Buenos Aires para teleSUR, Fabián Restivo.
And to better understand the current situation, let's look at more details in the context of the protests taking place in Argentina against the veto of laws of President Javier Milei.
The Argentine healthcare system is mixed, decentralized, and universal, comprising the public system, social security, and private healthcare. The public system functions as the cornerstone of care for vulnerable sectors, and has more than 1,500 hospitals and 8,000 primary care centers. The Ministry of Health coordinates at the national level, while the 24 provincial jurisdictions are responsible for local management. Since Javier Milei took office in 2023, fiscal adjustment policies have been implemented, including budget cuts and vetoes on key public health legislation. For example, the veto of the Pediatric Health Emergency Law, approved by a majority in Congress, has halted essential budget increases for the Garrahan Hospital and other children's hospitals. This has resulted in a real decrease of 54% in the Garrahan budget in 2025, affecting the quality and capacity of care. The hospital has faced layoffs, resignations, wage delays, and precarious working conditions, especially for medical residents, whose training has also been affected by Resolution 2109 of 2025, which makes their working conditions precarious. These policies have led to protests and massive strikes by workers and professionals at Garrahan, as well as social mobilizations demanding the repeal of the vetoes and greater investment in public health. These measures have a serious social impact: restrictions on access to treatment, reduction in preventive campaigns, and the suspension of essential public health programs. Vulnerable populations, who depend on the public system, face a deterioration in health care quality and an increase in health risks, especially children. Recent protests at the Garrahan Hospital not only defend the continuity of pediatric health services, but also denounce a political model that prioritizes economic adjustment over the right to health. The crisis highlights the tension between neoliberal policies and social rights in Argentina, with a critical public healthcare system in danger under the current government. The current crisis, precipitated by President Milei's vetoes and cuts, and strongly manifested at the Garrahan Hospital, reveals how fiscal adjustment decisions affect staff working conditions and access to essential health services, putting universal rights and social inclusion in health at risk.